In the preceding segment, we explored why we become fat. And the explanation was that we become fat because we use a particular drug called carbohydrates to manage our emotional needs, and we do that in excess and ignore the harm it causes us. So that obesity is a substance abuse problem, and it's the consequence of that relationship rather than being the direct problem itself. So in this segment, we're going to talk about why diets fail. Okay? Some people use alcohol to manage their emotional needs, and that's fine, but if they supersede their boundaries, they become alcoholics. That's when you ignore the negative to continue to get the pleasure from the drug. Okay? An alcoholic is somebody who's lost their ability to control their relationship with alcohol. A fat person is somebody who has lost their ability to control their relationship with carbohydrates, and the consequence is their obesity. So they're out of control, and they do not have and never will have control. Okay, so I'm fat and I want to lose weight. Let me go on a diet. The simplistic premise of every weight loss program out there is that we became fat because we consumed more calories than we used. So the foundation of every weight loss program out there in the world is to reduce your caloric consumption and increase your caloric output, and thereby you lose weight. And in a very simplistic way, that's true. But here's what it doesn't account for. It doesn't account for the addiction element. So when you engage in a weight loss program as a fat person, you cut down on your calories. They tell you you can have a little bit, but you can't have a lot. You can have a few scoops of brown rice, 3 scoops, no more. You can have 1 slice of brown bread, but no more. And don't eat ice cream. They're telling somebody who specifically has lost their ability to control their relationship with a particular drug called carbohydrates to control it. That's like telling Lindsay Lohan you're only allowed to drink 3 beers at night, you're not allowed to drink whiskey, and you're not allowed to drink more than 3 beers. Well, Lindsay Lohan is an alcoholic. Her problem is not a DUIs, her problem is a relationship with alcohol that is out of control. No alcoholic, once they give themselves permission to drink, can stop drinking. No fat person, once they grant themselves permission to eat carbohydrates, can realistically stop. So therefore, diets are the ideal setup for us to fail because they're telling us to tightly control through restriction something we don't have the capacity to control. Lindsay keeps on getting DUIs because she's giving herself permission to drink, and she's just trying to control her drinking. Fat people keep failing diets because they're trying to restrict something they can't restrict. If you truly want to lose weight, what you have to address is the reason why you became fat in the first place, which is your out of control relationship with carbohydrates. Well, if that relationship is out of control, the effective way to manage it is to distance yourself from your drug of choice so that at an emotionally vulnerable time, you do not have easy access. If that stuff is in your environment, at some stage, you're going to access it. If it's not there at an emotionally vulnerable time, you don't have access, you can't do yourself harm. So the appropriate management of obesity is using similar principles to any other drug addiction management program. And that is through abstinence and through creating an environment where behaviorally you do not depend on or access that substance to deal with your emotional needs. And it is a process of progressively distancing yourself from that drug of choice and then replacing your relationship with that drug through other mechanisms that equally well dissipate your emotional needs without causing you harm. So in our program, we do not run a weight loss program. We run a substance abuse program. We run a lifestyle change program. Now, what do I mean by this sexy word called lifestyle? Everybody says, oh, lifestyle change, but nobody can define it. Here's my definition of lifestyle change. Lifestyle change that we help obese people to do is to change the mechanism by which you manage your emotional needs, away from consuming a substance toward the action of doing things with this as it returns to more effectively and more appropriately manage your emotional needs by doing things rather than consuming things. Lifestyle change is changing the mechanism you typically use to manage your emotional needs. And if you can do that successfully, you will not be fat. Lindsay will not get another DUI if she stops drinking. You will not be fat if you stop consuming carbohydrates. But as long as you try to restrict your access to calories, you'll always be in some stage of weight loss or weight gain, but you'll always be fat.